United was never a big player in the exchanges. It came in very tepidly initially and has not been very aggressive or interested in the exchanges. They've only had about 6% of the enrollees in the exchanges, so it's not really that big an upset for the whole thing.
Obamacare architect Zeke Emanuel on MSNBC's Morning Joe earlier saying that the news of major healthcare provider United Healthcare leaving the Obamacare exchange isn't a big deal. Let me tell you something. United Healthcare's exit is a huge blow to the exchange, but even worse news out from a new study conducted by Blue Cross and Blue Shield. It says that people who signed up for insurance after this law was passed generally had higher rates of disease than those who enrolled before, meaning premiums and costs will rise so insurers can cover higher cost patients, while younger, healthier people have stayed away in droves. For more, we've got Just Who the Doctor Ordered. Our Newsmax health editor, Nick Tate. Nick, of course, also the author of the book, Da Vinci's Baby Boomer Survival Guide. Nick, let me turn your attention to something else you wrote, the Obamacare Survival Guide. Now, to borrow a famous phrase from 2008, the chickens are coming home to roost.
No question. I mean, the promises that were made in 2008 that health care costs would go down and premiums would go down is just flatly wrong and ridiculous. And for us to hear now that the nation's biggest insurer pulling out of Obamacare in those 34 states is no big deal, it is a big deal. What United Healthcare is saying is that prices have gotten so high that the insurer cannot cover about $1 billion in losses. And as we pointed out at the beginning of the program, we're going to be looking at price increases that are at least going to be in the double digits, in the low teens, or maybe even higher in rural areas and places where health care is more costly to provide and there are fewer services available.
Now, this goes beyond differences of opinion. When you have someone like Zeke Emanuel, who sociologically has had an interesting take on things. I can recall an earlier visit on Morning Joe when he said we basically had a duty to take ourselves out, so to speak, in our mid-70s so we don't
75.
develop dementia.
Right.
So he arbitrarily says Americans should leave the planet at 75. My goodness, I guess what really ought to die a death is Obamacare, bureaucratically speaking.
Well, as one of the authors, he also said after he left the White House that 90% of employers that now provide health benefits to their workers will be out of the business of providing health care to their workers in the next 10 years because of Obamacare. So, as you say, the chickens are coming home to roost. Costs are going up because most of the people that are signing up for these new plans that are offered on the exchanges and through companies are sicker. They tend to be older. Fewer younger people under the age of 35 who pay more into the system than they take out of the system for benefits are not signing up. They're simply choosing to pay those very low fines. And the net effect is that not only are we paying more money, as we have been for the last couple of years, those numbers are going to go up, and there are fewer choices, fewer doctors, fewer networks available for those people who do have insurance.
I know you give us the who, where, when, what, and why. I've got some more motives at work here. I just believe, knowing this crowd as I do from my days in Washington, they set this up to fail because they want to completely socialize medicine.
It's a good argument. In fact, many believe that there was no way that a single-payer system, nationalized health care, could be sold to the American people or members of Congress. So the argument is maybe they made it so complicated with 2,500 pages of regulations, 500 specific regulations, and would lead it to this point that people would say, well, this just isn't going to work, we need something else. But the solution of a single-payer system, nationalized health care like they have in Europe and Canada, just will not work here. So the question is, what do we do now with this thing that is clearly having a lot of unintended and some would argue perhaps intended effects that are bad for consumers? How can we mend and fix or jettison this thing?
Well, and that becomes the thing, because when you talk about mending it, there is a whole lot of suspicion. Folks looking in here right now go, oh, now we're going to get son of Obamacare, and it's going to be a disobedient child that'll gobble up even more tax money.
Maybe so, and I understand how people feel that way. I do think there are some things we could remove that would, in fact, immediately boost competition and bring down costs. Eliminate the employer mandate requiring big employers to provide health benefits. Let go of some of those standards that health insurers must meet so that you can have a health plan that's best for you, that's at a cost you can afford, and not these gold-plated plans that are required by the federal government.
We will have to leave it there. Nick Tate, we thank you for your input on this important subject.
Good to be here.